Dr. Melissa Farrell, the president of the St. Joseph's Healthcare Hamilton, Rob MacIsaac, president and CEO of Hamilton Health Sciences, and Keanin Loomis, president and CEO of the Hamilton Chamber of Commerce. Very pleased that both all Melissa, Rob, and Keanin are here to bring their special message to the community and the media today. And as you may have heard earlier today, Hamilton remains in the red category, but that in my mind is not necessarily a cause for celebration. It is still up to each of us to individually and across all sectors to do our part to help slow the spread of this virus. So as Dr. Richardson always reminds us, everyone in the community must continue to follow the advice from our public health team. What's that advice? It's restrict close contacts to your household members only. Doesn't mean aunts, uncles, and extended family. It means only those that are living in your home. Contain it to that. Those that live alone may join with another household for support. All in-person activities should be limited outside of the home to essential activities only. Activities like work, school, fitness, exercise, access to healthcare or getting your groceries, all of that's important. Beyond that, try and stay home as much as possible and restrict all social gatherings to only your immediate household members. Again, only those that are in your home, living in your home now, not extended family, not aunts and uncles, grandparents, as much as we'd all love that, and as I would too, this is not the time to do that. And wear a mask, face covering whenever around others from another household, or when you're out in public places, or when you're outdoors and you're unable to physically distance yourself. And of course, lastly, and often most importantly, wash your hands as often as you can to prevent the spread of this disease. For any of the COVID-19 symptoms, if you're feeling them, stay isolated at home and get tested for COVID-19. Don't go to work. Get a feel for what the impact of your not feeling well is, and getting that test is ever important. And the speed at which you can get results now is increased significantly. So do take the time to take the test. And do remind you that this step in red, staying in red, is only one step away from a full lockdown. And our numbers are creeping up to that full lockdown level. So we want to do our utmost to keep those numbers down, especially at this time of year when people do want to get out and about. We're encouraging you not to do that. Stay home as much as possible, and use the online services in terms of the shopping that needs to happen out there that I'm sure many of us would want to get at and do. I'll now pass it over to Paul Johnson, our Emergency Operations Center Director, for some of his thoughts around what this red category means and how we're going to implement that and enforce going into the future. Paul?
Thank you very much, Mr. Mayor. And as you mentioned, there was much speculation about heading into the gray category today, and that has not happened. It is no cause for celebration. I think it's important, and you'll hear the actual numbers from Dr. Richardson in just a minute, but every major metric that you would use to determine where you are in terms of the categories under the provincial framework are worse, and many of them by a significant amount from when we first entered into the red category. So this is not a moment of saying, man, we've really done our job. We're working hard on things and seeing the results of that. In fact, we need to continue to do some things, and in a moment you'll hear of some of the further requirements that we're going to place on a number of elements of our community in just a minute from Dr. Richardson. I would say that as a result of remaining in the red control category, our enforcement and our work around this continues as it has since we entered into this category. Enforcement is no longer about education and some of the things that have been in place for weeks and months in many cases. This is about compliance. And it's also, I think, important to note that from time to time, and in top of our own municipal law enforcement officers who are out there and the police who enforce under these rules as well, that provincial resources do come into communities all over the province from time to time. And so there will be enforcement from a variety of folks on an ongoing basis through this pandemic. And it is there in workplaces, whether you are customer facing or not. It is there in private settings if we receive complaints. And in fact, last weekend, we had complaints about parties that were going on in social settings, not businesses. and responded and enforced as we needed to. This is where we're seeing some of the spread happen, is in those social activities that are going on and people's continued desire and against all of the rules, and in fact, some of the regulations that are in effect, continuing to socialize with too many people and doing it in an unsafe way. And so some of what you'll hear today is further measures to try and control that. But in some cases, this is about our own personal behavior. And we continue to encourage everyone to do things in safe ways. They are not overly restrictive, and yet they will allow us to do the kinds of things that we want to continue to do in our community. So we, as you know, have had for the last number of weeks now, a special group of bylaw enforcement officers who are our COVID response folks. They are 7 days a week. They are there in the morning hours, afternoon hours, and in the evening hours. So this is not a daytime hour or business hour type of thing. We're there 7 days a week, morning, noon, and night, out there to enforce. And if the community does feel there are areas of concern, please feel free. 546-CITY is the city number, and you can log a concern or complaint there, and we will follow up on it. Of course, it's not a 911 type service, so we may not be able to get there in time to deal with the specific issue you saw, but it is always good for us to know where people feel things are not going well in their own travels. We can go out, reinforce messages, and if there are things going on that are not in compliance with our bylaws or with the orders from the province, we can take care of that. So lots of things you can do in our community, lots of safe ways to get out and recreate and do things, and we encourage everybody to do that. But today's message is going to be about the way that we need to continue to control the behaviors that are driving the spread of this virus and causing us on a number of fronts to be concerned about congregate settings, about our healthcare facilities, as you'll hear, and not wanting the folks that work in these environments to be off sick, and certainly not wanting it to spread into vulnerable populations in our community. With that, I'll turn things over to Dr. Richardson for announcements on today's enhanced measures.
Thanks very much, Paul. And you heard me speak earlier this week about being very concerned, and I remain very concerned. As you heard from the Mayor and from Paul, these are concerning numbers that we're continuing to see, and it's while we're not yet in the gray or lockdown zone, we are very close to that. And so not at all a cause for celebration that we're staying out, but still significant issues, and that's what we're going to talk a little bit more about after I give you the numbers. So today we're at 3,402 cases with 81% resolved, making it 537 active cases going on today in the city of Hamilton. We've had 94 deaths now to date, and as you've heard me say previously, we've now surpassed the number of deaths that we saw in the first wave of COVID. There were no new deaths today, but we are reporting a total of 22 local outbreaks on our website, with one new outbreak added today at Sir Wilfrid Laurier Elementary School. So over the past few weeks, the latest weekly rate of new cases has been increasing, and this is the weekly rate per 100,000 population, and we're now at 79.7, which is double the threshold for entering into the red or control category. The average number of cases, our 7-day moving average, is at 67, and our percent positivity among our test results is 3.2%. We've continued to see cases that are related to people socializing, to people not following public health measures, and as well, we've seen an increased number of outbreaks over the last 2 weeks in workplaces. As always, I'll leave you to look for more detail about our numbers and the outbreaks on our website, but I do want to talk more about the enhanced measures that we're taking today. So we did receive confirmation that we would remain in the red control category from the provincial government earlier today. As you know, local medical officers of health have been encouraged to take additional measures to address local circumstances, and that's what I've chosen to do here and announcing that today. We've been seeing this increasing rise in numbers, increasing numbers of outbreaks as well. And so in order to reduce transmission, I am issuing instructions under the province's Reopening Ontario Act. The enhanced requirements are going to come into effect at 12:01 a.m. on Saturday, December 5th. That's overnight tonight for retail outlets, and at 12:01 a.m. on Monday, December 7th for shopping malls, for workplaces. Some of the implemented measures are going to include reduced capacity and limits at shopping malls and retail establishments, active screening at workplaces, shopping malls, and retail businesses, the posting of capacity limits based on physical distancing requirements, and appointing a manager to develop, implement, and actively monitor a safety plan in workplaces, shopping malls, and retail businesses. I'm going to remind you that in addition to the framework and requirements, members of the public are advised of the following: that trips outside of the home should only be for essential reasons, for work, school, groceries or pharmacy, healthcare, assisting vulnerable individuals, or for exercise and physical activity. Restrict close contacts to your household members only and to essential supports. Those that live alone can join with one other household for support. Indoor organized public events and social gatherings should only be with members of the same household. Virtual gatherings or events are, of course, the safest way to visit or recognize occasions with people outside your household. We are encouraging people to work remotely wherever possible and for employers to make that possible wherever they can. Wear a mask or face covering when around others from another household, out in public places, or outdoors when unable to stay physically distant. So that would include if somebody was coming into the household to provide essential services, then both parties would be wearing masks. Washing your hands often, using alcohol-based hand sanitizer when soap and water aren't available. And of course, please, if you have any COVID-19 symptoms or are not feeling well, to stay isolated at home and get tested for COVID-19. With that, I'll turn it over to Melissa from St. Joe's.
Thanks, Dr. Richardson. We're obviously concerned about the numbers that we're seeing this past week as well. And we're at St. Joe's supportive of the enhanced measures that you're putting in place from a public health perspective. We think that this will really help us ensure that we can maintain our essential healthcare services to the community. That's obviously our primary goal. You know, when I'm saying essential healthcare services, I'm talking about our inpatient care, surgeries, outpatient clinical care for medicine, obviously the mental health programs that we're providing at St. Joe's. What I can tell you is that we're managing and watching the numbers very closely. We're watching it on a daily basis, and in fact, at times we're watching it many times a day to determine if we have to ease down on any of the services that we're currently providing. We're collaborating with our regional partners, and I know Rob will probably talk about this too, but lots of work that we're trying to do together to make sure that we have the healthcare services available when we need them. And of course, we're spending the time internally really monitoring our bed capacity, occupancy, surge capacity, our ALC numbers, staff availability, so that we can maintain the services that we know that individuals need. We're obviously, though, open to the fact and know that we need to potentially change quickly and react swiftly as needed to the changes in the situation. And I know Rob will likely talk about the outbreak that's going on at HHS, but that's an example where we will support each other. Just as HHS supported us in terms of outbreak, we will support them too. I think another point that's just really important, and I know Rob will support this as well, is hospitals are safe for care, and it remains open and safe for patients to come to. And we would encourage people who require care to please continue to come for care. We have great processes in place to support patients who need our services, but these numbers are very troubling, and we are certainly supportive of the measures, the enhanced measures that you're enacting. We really are in this together, and we need to work together. We need everyone to be really paying attention to the advice that's coming from public health. So I'm going to turn it over to Rob.
Thanks very much, Melissa, and I certainly support all of Melissa's comments. You know, we're approaching our 10th month responding to this pandemic, and as has been noted, hospitalizations continue to increase across the province and within our city. We've seen some of our peers in the province become overwhelmed by the combined impact of internal outbreaks, community outbreaks, rising volumes of COVID, staff quarantine, and generally high seasonal demand for hospital services. Hamilton Health Sciences has been at over 105% occupancy this week. So the stark reality is we don't have capacity to deal with a significant second wave of COVID without scaling back other services. At HHS, we're currently caring for 29 patients with COVID-19. 5 of these are in intensive care. So that's more than double what we had a month ago. As Melissa mentioned, we currently have 2 COVID outbreaks on 2 separate wards at the Juravinski Hospital and Cancer Center. We're still awaiting some test results, but so far 3 patients and 2 staff members have tested positive. We are doing all that we can to limit the possibility of any further spread at JH. We've closed those 2 units for admissions. Visitors are currently not allowed on those 2 wards except for compassionate reasons. I want to say I'm really proud of our workforce. I think they're performing at an exceptional level. They're being really diligent to follow infection prevention measures in our hospital and in their personal lives. Where we have had staff members test positive, for the most part, we have not had to further isolate any other staff because our staff have been following strict infection prevention guidelines around mask wearing and physical distancing at work. In short, our staff are not putting each other at risk because they're following the rules. Despite all of that, for various reasons, we have 74 staff members in isolation for a variety of reasons. So in response to what's happening within the community, we are preparing for some policy changes. And I know that HHS and St. Joe's are almost exclusively aligned in terms of our policies, but we'll be increasing testing for our patients starting on Monday. People who are going to have procedures or surgeries. We're also introducing some additional restrictions to visiting. I've just encouraged people to check with the hospital before you come in to make sure you understand what the visitation restrictions are. So our healthcare system is facing some very difficult choices. I think that's going to continue for all these reasons. HHS also supports Dr. Richardson's enhanced restrictions. We really need our community to stay focused and help control the spread of this virus. Wear a mask, wash your hands, watch your distance. Trust the advice of medical experts, follow public health guidelines, and encourage your family to do the same. Thank you very much. I'll pass it over to Keanin.
All right, thanks, Rob. Well, I just want to thank all of our health professionals today on behalf of our board and our 1,000+ members for all of their incredible and indefatigable efforts since March. And I want to thank Dr. Richardson for her engagement with the business community in developing what I think are some creative options to ensure that our small retailers can continue to remain open right now during the holiday season. Though this is not a cause for celebration, as the mayor said, and as Paul said, this respite does elicit a huge sigh of relief for Hamilton's businesses. They're counting on a big December, and every day, every week that we can avoid lockdown will be a step to ameliorating a difficult year to individual businesses and our local economy. Because of the volume we're seeing, because of holiday shopping, especially among the larger retailers, distancing is getting difficult. So I think these measures are targeted and reasonable and a nod to the small business first retail strategy that our contemporaries at the Canadian Federation of Independent Business have been championing. And I've liked their advocacy so much that I've been really happy to be able to provide that type of advocacy here in Hamilton. So again, thanks to Public Health for the opportunity to channel the voices of our members. We sit at the infection prevention and control table, and I think that that has helped a lot. And thank you as well for seriously taking into account the impacts of businesses when designing measures to help control the spread of the coronavirus. We will share today's details in the orders to our members and work with them to ensure that there is clarity and buy-in. We're just working through the measures ourselves right now. They're 7 pages long. We will work with our more particularly impacted members as well. I talked to Liam Vu today of Cadillac Fairview. They run Lime Ridge Mall. I don't think this is going to be particularly onerous on them because they have been so great already in controlling the number of people that are within that building at any one time. And of course, we remain here at the Chamber to assist businesses and help them navigate all of the measures, both provincial and municipal and federal, that pertain to them, such as the creation of a safety plan. Of course, there are a lot of government subsidies out there as well for impacted businesses, and so much else is out there. So we remain, as I said, as a resource. Go to our website, hamiltonchamber.ca. In the top right-hand corner is a COVID-19 microsite. Pretty much everything you need is there. If not, there's an opportunity to ask questions. There's a real live person at the other end of that question who will provide an answer to you very, very quickly. As well, I remind you that Public Health has worked really hard with us to create a dedicated line for businesses as well. That's at 905-546-2489, extension 4. So I'm sure that there will be questions as a result of today, but know that you are not alone in navigating all of the measures. And our hope is that these balanced measures can help us avoid a lockdown, I would encourage every business to develop a lockdown plan, because as Dr. Richardson said, we are on the edge right now, and we probably will be for quite a while. So that is it for me, and I'm going to turn it over to the mayor now.
Well, thank you, Keanin, for that great input and support, as well as from Dr. Richardson and Paul and Melissa and Rob. Thank you, and certainly compliments go to all the healthcare workers, all the frontline workers, whether it's in the grocery stores or in the retail stores, and especially in healthcare, long-term care. These folks are doing everything humanly possible to keep people safe and cared for. And I can only imagine the stress and strain they're under on an ongoing basis. So please pass on my compliments to them. And a reminder that, we've got to stop this virus. We've got to stop the spread. I also will remind you that these are not suggestions that the doctor laid out earlier. These are requirements. These are regulations that are going to be enforced. And we encourage you to adopt them as quickly as possible and adhere to them, because enforcement will be out there. It'll be proactive, and it'll be enhanced as well. So please get on top of those issues. And I know that the business community can hopefully share all the very important information that they're going to have to implement quickly. And the smart ones probably already have, and those that haven't certainly need to step it up. As Greater Toronto Hamilton neighbors, we meet regularly talking about how we can continue to support, and we encourage all businesses and individuals to continue to look at the supports that are already out there in terms of financial supports for individuals, or financial supports or rent supports for businesses. But we're also going to be advocating for our provincial government to look at very, very strongly paid sick days and income supports, better work protections, especially for agency workers, rent supplements and eviction protection for individuals and businesses that are out there. More workplace blitzes are going to be happening, especially in high-risk sectors. And they should be providing some culturally tailored communications, especially for new Canadians to understand their rights as workers, because we are seeing a lot of impact in industry that has to be, we have to stay on top of, and certainly some of the workers out there might need that communications in a different language. So we encourage the province to look at all these measures as important measures to help prevent the spread of this virus. And paid sick days is one of the even the more important ones, where people are afraid to take a day off even if they're sick, because they're going to lose pay. And obviously their income is, so ever important. And so there's got to be some offsets for that. So we're going to continue to work with our provincial governments to encourage them to put more supports in place to help people take the measures that we're encouraging them to do, which is if you're sick, stay home. If you're working in the workplace and you're ill, go home and get a test. Don't infect anyone else. And let's make sure that we put all of those supports in place in partnership with the province. On that note, Jasmine, I'm going to turn it over to you. I know the media is anxious to ask questions, so we'll let them get at it.
Great, thank you, Mr. Mayor. As usual, we'll start with one question and one follow-up for everyone. First question goes to Dan Takema from CBC Hamilton. Dan, you can go ahead.
Hi there. Looking for some details on these new requirements that have been put in place. I don't know if that's better put to Paul or to Dr. Richardson, but do you have some specifics around these in terms of capacity limits and so on?
Thanks very much, Dan. You should have just received from Jacqueline Durlov a media release that includes the instructions themselves, so that you'll have the full details in front of you very shortly if they're not in your inbox just now. So they include the screening instructions, so the specifics about screening for people who enter, about limiting entrance into malls and into retail spaces, and the types of screening tools to be used. They include the requirement to calculate a capacity limit based on keeping people physically distanced in the space, and to post that and the basis on which it's made. They do include for all employers the active screening again before people attend at the workplace to ensure that they've been screened, and if they are screening positive, that they're excluded from work. It also includes the safety plan requirements, and so requiring all businesses and retail to develop a safety plan and ensure that it's implemented and monitored by their management staff. So the nitty-gritty details are there within the document you'll have gotten, but that's the overview.
Thanks. Okay. And then just in terms of your conversation earlier today with provincial officials who notified you that you were staying in red, was there any sort of warning or message there, as we've seen some rather high case numbers and outbreaks continue to rise here? Any warning from them about the lockdown potential there?
Well, they're very concerned, just as we are. They've watched our numbers go up over the last week. They, like us, were hopeful after that first week. It looked like we had some leveling out, maybe even a bit of a downturn. But then seeing our numbers shoot right up afterwards. And so they're quite concerned. And they're very much wanting us to get this under control and bring those numbers down.
Thanks, Dr. Richardson. Next question will be to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi, thanks very much. My question would be, I guess, for Rob and Melissa, in terms of you assuring people that it's safe to come to hospitals to still come and get their procedures done and things like that. Are you actually seeing more people canceling appointments and procedures? And if so, do you have any idea how many are doing so?
Yeah, maybe I'll start. I cannot put a number on it. I know there's no question that since the onset of the pandemic, there has been a marked reticence for people to come in. We have had a lot of no-shows and cancellations over the last 10 months. And that's why I think both Melissa and I would encourage people not to squander that precious resource that those appointments represent. In terms of what has happened over the past couple of weeks or month, sorry, I don't have a specific number. Melissa might have that.
I don't have those numbers with me either, but I would pretty much echo exactly what Rob said. We did see a market change and this concern that people had about coming into our health organizations. And it wasn't just for procedures, it was also the emergency department volume. And that is one that we track very closely. Right now, our ED is full. I know it's similar at Hamilton Health Sciences as well, our ED and our urgent care center. But we have tended to see that when the concerns go up, we actually see those numbers drop. So we're at pre-COVID numbers in terms of our ED right now. And we're just encouraging people that as we move forward, to continue to come to the hospital when they need to come to the hospital.
Okay, good to know. Thanks. My follow-up question would actually be for Dr. Richardson. We were speaking with Minister Lecce yesterday about the asymptomatic COVID-19 testing that's in some schools across the province in kind of COVID hotspots. He said if there was a demand going forward for more asymptomatic testing in other regions like Hamilton, for example, that the province was open to doing that, but it would be up to the medical professionals and their input as to whether or not that happens. Is that something that a local medical officer of health would be participating in discussions on, or just the provincial medical officer of health?
Thanks very much, Lisa. So when it comes to that particular part of the screening program, right now that's largely being run provincially, and discussions are happening at that level. There are sometimes opportunities for us to have some input, and certainly we're all watching how this piece about asymptomatic screening and the new tests rolls out. You'll know that St. Joseph's Hospital has a number that they're helping to pilot and be part of. So we're all involved in different aspects of it, but that particular one around schools is by and large being managed provincially.
Thanks, Dr. Richardson. Next question to Jason from CHCH. Jason, you can go ahead.
Hi, everyone. Can everyone hear me?
Yep, we can.
Okay, perfect. Good afternoon, everybody. My first question, I guess, is for Dr. Richardson. Going back to a potential lockdown, I mean, what are health officials specifically looking at when it comes to making that decision on moving up to that next level?
Thanks very much, Jason. So if you look at the parameters around how we move between the levels, yellow, green, orange, or sorry, green, yellow, orange, red, and then into lockdown, there's very defined parameters for everything up to that lockdown level. And that has been left by the province as being something that's more a qualitative discussion about what's happening. So increasing number of cases, outbreaks, those are all factors that go into it, test positivity rates. And so there is, we've certainly got two regions in the province, Toronto at Peel, that are way ahead of us in terms of those numbers. And they've gone into lockdown, and we're all anxiously watching them as well to see what happens there, and knowing that we're just coming up the end of the third week with those folks. But it's much more a qualitative piece, and in the discussion so far, the decision has been made by the province to leave us in the red zone. But we definitely think these enhanced measures are necessary because of the specific issues that we're seeing here in Hamilton, and so that's why we're putting them in place.
Okay, and my follow-up is back to Dr. Richardson. I mean, was there a specific metric that kind of broke the deal of whether to move into a lockdown in today, of not deciding not to go in?
So those decisions are actually made by the Premier and Cabinet. So I'm not privy to those decisions as to exactly when they decide which zone they're going to put us into. So you'd have to turn to them for that answer.
Thank you.
Okay, next question will go to Sebastian Braun from the Hamilton Spectator. Sebastian, you can go ahead.
Hello, this is for Dr. Richardson. We know that Premier Doug Ford consults with medical officers of health with respect to moving up or staying put in the color-coded tier system. And as you just mentioned, it was their decision to sort of stay put in this red zone. Did you recommend a lockdown to them? If not, what did you recommend?
Thanks, Sebastian. So as we go through those conversations, because they're qualitative, it's really more of a discussion about what's going on. And so I definitely expressed, a lot of concern about what we were seeing in Hamilton, the trends that we've seen, talked about, what they've seen in the lockdown areas, what their experience has been, because of course they have much more experience in talking to all the health units across the province and asking them, what they were seeing. And I expressed that I definitely wanted to at least see these enhanced measures here in Hamilton at the very minimum. And would be doing that in one way or another, and then ultimately, left for them to discuss at the broader level how this fit with the broader picture. So we knew we needed to move forward. We needed more measures in terms of bringing us under control, and for me, this was certainly part of what we needed to see.
Were you left a little bit disappointed in them not taking that extra step?
You know, I think as we're moving forward, my issue is not with the extra step. My issue is, you know, really our inability to get these numbers down. So whatever measures we take, really what we're seeing, I go back to the primary factors that are driving it, and it's that we are continuing to see the socializing. It is that we are continuing to see, unfortunately, circumstances in workplaces where people are not following the measures that they need to take. And so really that's where our focus needs to be, is figuring out how we can get people to take those measures. We need that behavior change that Paul talked about earlier on. We need people to bring down that level of risk. And, you know, this is part of why we talk to business about, look, what's practical, what's going to work, what can we do to reinforce those behaviors, to reinforce those measures. And so that's the piece where I'm focusing right now.
Thanks, Dr. Richardson. Next question to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thanks for taking my questions. This question's for Keanin and Loomis. I'm wondering what kind of economic impact would we see under a lockdown in Hamilton, and what are you hearing from businesses? You know, are they worried about a looming lockdown?
Thanks, Katrina. Yeah, there absolutely are. I mean, we started to put out some messaging earlier on this week, just getting everybody prepared, and it started to really resonate among the business community. And certainly, there's a lot of concern. We know that lockdown in the spring had a huge impact on the businesses and on the economy. We also know that businesses now are in a better position. They've had a long time to go digital. So it might not have as much of an impact, but we also know that December is supposed to be a great month for business, especially for retail. And so just the timing of this would have been very difficult. So I think, you know, again, it's not a cause for celebration, but it is a sigh of relief at this point in time, especially because we're not seeing as the doctor said, we're not seeing transmissions in that business to consumer transaction. So, you know, we really appreciate the opportunity to continue to be able to facilitate commerce during the holidays and help these businesses make up for what has been a terrible year.
Thanks. And then my next question is for Dr. Richardson. And I know this might be laid out in the email that we just received, but I'm wondering with malls, so there are going to be capacity limits within the mall. Are there also meant to be limits within stores? Like, it just seems like it really varies from store to store right now in the mall. I'm wondering if there's going to be any more consistency with like rules that every store has to follow.
Thanks, Katrina, and I appreciate you looking at that particular point, because it's an important one. It is for the mall as a whole, as well as for the individual stores in the mall. So, I mean, in terms of screening, it only makes sense to screen once as you go in, because you hopefully won't have things change in the few minutes between when you enter the mall and when you move to another store. But certainly in terms of calculation of the capacity requirements, those are for the mall as a whole, as well as store by store, as well from the standpoint of being a workplace and employer. The active screening that is required of the employees needs to go on before they come to work. So it is for both in those circumstances.
Thanks, Dr. Richardson. We will go through one more time if media partners would like to ask another question. I'll start first with Dan Takema. Dan, if you'd like to ask another question.
Sure, Dr. Richardson, I'll keep you going here. And just jumping off what Sebastian asked about, you said that you wanted to see at least these steps being taken. And I can understand that your concern is with how things are spreading here, but I'm curious if you'd like to see, or if you were, I guess, hoping or anticipating that we'd be heading into lockdown, and if not, if you are anticipating adding more restrictions if case situation doesn't change.
So when it comes to lockdown, ultimately, if we, continue to see increased transmission, I'm sure the discussions with the province as we continue forward, that's again going to be what we continue to look at, is at what point do we go all the way there, knowing that's ultimately their decision. So we'll keep monitoring the situation and seeing what happens. We do know it takes a good 10 days to see an impact from changes, 10 days to 2 weeks. to begin to see an impact. So we're hoping we'll still see an impact out of coming into red. We'll be looking for an impact of making these decisions, and hopefully those numbers will come down. But we'll keep looking at what's happening, what our experience is in terms of outbreaks, cases, that sort of thing, and continue to add any other control measures if needed.
Great, thanks. We'll go next to Lisa Pileski, CHML. Lisa, if you'd like to ask another question.
Thanks very much. I guess my question kind of builds off of Dan's a little bit. If there are enhanced restrictions, is there a reason kind of that restaurants weren't included in this this particular round of enhanced measures, or is it just because retail outlets are genuinely more busy around the holidays?
So many of the restrictions that we're requiring here are already really addressed in the requirements under the regs. So they already have a capacity limit in terms of how many people can attend there. They already have the screening measures that are in place in those settings when they're going through with patrons. So really the focus was on the other premises and the workplaces where we are absolutely seeing cases occur and addressing those areas.
Great, thanks. We'll go next to Jason from CHCH. Jason, if you'd like to ask another question.
Yeah, this is for Dr. Farrell and Rob as well. So in regards to the hospitalizations, is there a way you can characterize how the hospitalizations have been different now than they were in the spring? Is there a way you can elaborate on that?
I think, so that's a good question. I think off the top of my head, we did see some fairly spiky kinds of admissions in the spring because of some very significant decanting that went on with the Rosslyn and so on. So what we're seeing now, I think, is more slow, maybe not as slow, but a steady growth, I guess is a better way to say it, in the number of patients we have, whereas we saw a big spike very quickly in the spring, which ultimately tapered off as we got deeper into the year.
I was just going to say the exact same thing. So it really was, we saw a spike in the spring that came from some, a few specific circumstances where we're seeing a large volume of admissions at the same time, where this time it's been more steady increases when it comes to the admissions. And I also think we just have to really acknowledge our partners in congregate settings in some of these long-term care homes who have been trying so hard to keep COVID out, or when there are outbreaks, have been working really diligently, and in fact in partnership with both of the hospitals too, to try to keep those outbreaks to smaller numbers and actually keep the residents at those homes. So I think that we have seen a lot of progress from one to the other, although numbers again continue to remain concerning, and we'll see whether or not we can actually keep that going.
Great, thank you. Next question to Sebastian from Hamilton Spectator.
Yeah, just another one for Dr. Richardson here. You've sounded the alarm as it pertains to case counts and called our test positivity rate sobering. Where do we stand at the moment? Is it going to get worse before it gets better?
Yeah, that's the $1 million question, isn't it? Is it going to get worse before it gets better? And if it gets worse, we're right teetering on that edge when it comes to the hospitals and those sorts of things. Our capacities, as Melissa's heard about or talked about, the congregate settings and the things that they're doing to support, the hospitals are doing to support, and a whole group of players are doing to support our congregate settings. So, very worried that it will get worse, really worried, especially during this season, the holidays, when people are accustomed to getting together. They are, wanting to do the things that they've always done. These are traditions, of course, for many families that go back a very long time. And so, I'm very much hoping that people will instead find other creative ways. And as Paul said, it's a much more sober message today, but absolutely our staff in the city have been looking for ways that people can get outside, can do things, can enjoy. And, as our colleagues from Children's Mental Health said a few weeks back, about the core of resilience really builds around what can you do? What do you do in these difficult times? And so really needing people to embrace that, look at that, what they can do differently, how they can build their own resilience. It was a great line that Scott Thompson said the other day when I was speaking to him on the radio about, you know, how often we lament that we don't have the time to spend at home and spend with family. Or I talked about picking up the guitar and getting to play that for the first time in 4 years. So really hoping that people look for other ways so that those numbers don't get worse.
Thanks, Dr. Richardson. And one final question to Katrina Clark from Hamilton Spectator. Katrina, you can go ahead.
Thanks very much. I have a question about the public health's investigation of cases. I can see on the website right now, it says that there are 21% of the cases from the last 10 days are still under investigation. I'm wondering, is that because there's difficulty with public health being able to follow up with these individuals, or what the why they're still under investigation?
Yeah, thanks, Katrina. We're absolutely pushed when it comes to case and contact investigations. A little better on the contact tracing because we've had a remarkable degree of support from Public Health Ontario, and as well had the province join us, and they're giving us more supports in terms of case managers over these coming weeks. We've had a huge growth in staff, which is fantastic, but the orientation of them and getting them on board does take some time. So when we're at these higher levels of numbers, we do get pushed. We were successful in moving through that the last time we got to this point. I'm very hopeful that we'll get through this again in a number of days. We've actually redeployed some additional staff to case management again just in the last day or two. So it is very much a battle that we keep at in terms of doing it. We do not want to end up where Toronto and Peel ended up in terms of having to just say, you know, we're going to do priority cases only. But yeah, we are pushed when it comes to that right now.
Great, thanks, Dr. Richardson. With that, Mr. Mayor, that's the end of our questions for today. We'll pass things back to you.
Thank you very much, Jasmine, and thank you to our media partners for helping to share this information. Dr. Elizabeth, I didn't know you played guitar. I play guitar, Rob sings. I think we've got the makings of a TGIF band going here if Melissa has something to offer. Virtual though, virtual. Let me thank Bill Custers and the entire team at Cable 14, as well as Clear Cable, all of the people that help make these broadcasts possible and run smoothly. Thank you so much. And we're going to ask our citizens to, the biggest gift in my mind that you can give your friends, family, and community right now is to not be a participant in the potential spread of this virus. That's a gift to your friends, family, and community. Don't rush off to the stores this weekend. There's going to be limitations. If you can do online shopping, please support local as much as you can. The crowds are going to be out there possibly, and so if they're there, avoid them, because that is where the virus is going to spread. So stay home as much as you can. Go out for the essentials, as we've said earlier on. Keep your physical distance from people. Wear that mask and wash your hands as much as possible. So thank you all for tuning in. And if you need any additional information around the recommendations and regulations requirements that were outlined today, you can go to hamilton.ca/coronavirus. Lots of information there, not only of what Hamilton has done and the requirements that are being made, but also the supports that are out there for you in terms of individuals and businesses. So lots of information there that you're going to get access to, and I encourage you to avail yourself to those. And we will tune back in with you on Monday at 4 p.m. for further updates on what's going on with COVID-19 in our city, in our community, our province. And so thank you for tuning in. Have a safe weekend. Take care of one another. And we will see you on Monday, if not before. Thank you.